Okay, so the short notes of questions, shortness of breath questions, again, I will repeat and then we will proceed from there. So it is acute shortness of breath or chronic shortness of breath. The first question will be like this, and the course, how it is progressing fast or gradually. Next question, then the question, we have to focus the shortness of breath could be of cardiac origin or chest origin or related to other causes like anemia or some other diseases that I will highlight soon. So if it is cardiac origin, we have to ask the question like, this shortness of breath is on exertion or at rest. So mostly it will be on exertion. How far you can walk without getting the difficulty in breathing. So it will be gradually worsening. Okay, and then if it is there, then we have to ask the next question, can you lie flat and without any difficulty in breathing? So it means I'm asking about orthopnea. Then the next question should be, do you feel shortness of breath sometime while you are sleeping and wake up to catch your breath? Yes. Okay. So it goes in favor of paroxysmal nocturnal dyspnea. So more question you can ask. Okay. When you wake up with this episode of severe shortness of breath, did you have any cough also? Yes, I had the cough also. Was it productive? Yes, it was productive. And what was the color of sputum? It was whitish and it was having frothiness. Was there any blood? Sometimes there is blood tinge also. So it is going in favor of paroxysmal nocturnal dyspnea. Then we have to ask the question related to the swelling of the legs. Is it there? Yes, there is swelling of the leg. One leg or both legs, so mostly it will be in both legs. Okay, is it painful or no? So if it is because of cardiac origin, it will not be painful. If it is painful, we have to think about deep vein thrombosis or other causes. So once the patient is telling bilateral leg swelling, then we have to ask up to which level of your legs you have the swelling. Then we have to proceed from there and we have to ask the patient, do you have any tummy swelling or distension, to rule out the ascites also. So these are the questions related to shortness of breath of cardiac origin. The shortness of breath of interstitial lung disease will also be starting on exertion, gradually increasing shortness of breath with dyspnea and dry cough. So this will be the history. We have to differentiate between these two. Then we will proceed from there. We have to ask the associated symptoms related to chest and cardiac. So related to cardiac, first we can ask about the chest pain. Do you have any chest pain or heaviness? If it is related to ischemic heart disease, the patient will say, yes, I have the chest pain or heaviness, a central chest pain or left-sided chest pain. We have to ask then, is there any movement of this chest pain moving to your left arm or no, to the jaw or no, to the neck or no? If he says yes, it will go more in favor of ischemic chest pain. And is it associated with sweating? Then yes, then it will go to the typical ischemic chest pain, any nausea or vomiting together. So this will also favor ischemic chest pain. Then we have to ask about the heartbeat of the patient. Do you feel any heartbeats, either fast or slow? Yes or no. Then we have to ask about if it is there. For example, sometime my heartbeat is fast. Is it regular or no? Then you can tap on the table also. It is like this or like this. So these are the questions related to cardiac causes of shortness of breath. Then some causes or some shortness of breath, we have to focus the chest causes also. We have to ask shortness of breath. It is gradual in onset, increasing gradually, started on exertion. Then we have to ask associated symptoms related to the chest. Like we have to ask, do you have any noisy breathing or no? So to rule out any obstructive airway disease. Then we have to ask about the cough. Is it there or no? If it is there, dry or productive. So if it is dry, will go in favor of interstitial lung disease, and if it is productive, it will go in favor of either COPD or sometime with bronchial asthma and bronchiectasis cases. So we have to ask the question, what about the sputum production? Which time of the day you have more sputum production, and what is the color of the sputum, and what is the amount of the sputum? Then we have to ask question, do you have any blood in the sputum sometime in the past, to rule out hemoptysis? So these are the questions, associated questions related to shortness of breath. Then we have to try to do the dyspnea scale also, MRC dyspnea scale. Scale is 0 if the patient is having only shortness of breath at strenuous exercises, it will be 0. Scale 1 if it is at walking uphill or when the person is walking fast. Scale 2, when the person or the patient is walking at his level ground, but he is slower than his companions. Or level 2 also includes if the patient stops because of shortness of breath after 15 minutes of walking on the level ground. Then the scale 3 is if the patient stops within few minutes of walking at his level. And stage 4 is shortness of breath with minimal activity, like he is changing dress and he is developing shortness of breath. And scale 4 also includes shortness of breath at rest. Okay, stop recording now. Wait, just wait, please. So the other causes of shortness of breath we have to focus also, like anemia. Then we have to ask the questions related to anemia. Do you look pale more than before? Did somebody tell you that you're looking pale? Yes or no? If it is yes, then we have to ask more questions. Do you take balanced diet? Did you ever check your hemoglobin level? Blood test known as hemoglobin level. Yes, it was checked. What was the level? How much it was? So it means you are asking about HP level. Okay. Do you have any bleeding from any orifice? Any nasal bleeding is there or no? Any oral bleeding or gum bleeding is there or no? Okay. Do you throw up blood or no? Do you have any blood in your stool or no? Do you have any black stools or no? If female, how's your menstrual periods? Is there any heavy bleeding is there or no? So these are some of the general questions that we should ask if we are suspecting this shortness of breath is related to anemia. And is it a known case of anemia? We have to ask, is there any workup done and the cause find out the cause, what was the cause? So it will be helpful. Then we have to ask about any blood transfusion done in the past or no. Then to search the cause of anemia, we can ask also, do you have any blood thinning medicine? Are you taking any blood thinning medicine or no? So this is the complete package. We have to ask the question systemically in complete package in one go. So the examiners will give you full marks of clinical communication and clinical judgment. Right. So this should be the approach in dyspnea cases. Thank you.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.